Hello, I'm Shawn Tyndall. I'm the clinical coordinator for the undergraduate nursing students. Holly Woods, our administrative assistant, and I want to talk to you about clinical compliance and clinical placements. It's important for you to complete your clinical requirements as soon as you can. If you choose to wait to finish them, you'll be at risk for final placement. If you're unable to meet the deadline, you'll be removed from the clinical courses and will have to wait until the next term to re-enter. Onboarding for our acute care facilities is becoming more complex, and we must submit our paperwork several weeks in advance. Therefore, you see how important it is to be timely and compliant. In the workforce, professional nurses are placed on leave without pay until they're compliant. You'll receive one courtesy reminder prior to the deadline, so please do not delay.
Clinical placements will be self-selected, but remember, sites and circumstances can and do change. We place you at the best learning environment we can each semester. Use this time to learn not only your clinical objectives, but also take this time to learn about the mission and vision of the organizations you are placed at. This information will be most helpful as you look for employment upon graduation.
Remember, you're interviewing the entire time you're at clinical. This is a unique time to see if you might be a fit for the organization or for the nursing leaders to see your passion, integrity, and work ethic. Developing positive relationships can help open doors for you that other candidates may not have. In addition, working as a tech in healthcare can also get your foot in the door to interview or be recruited as an RN.
Look at Blackboard to see what specific clinical requirements are due and the deadlines. Pay attention to this notification and make arrangements to complete them as soon as possible, based on the directions that you receive. Remember, your compliance must remain current through the entire term. For example, your annual TB screening is to be completed the last month of the term that it expires. Immunizations are also required by our clinical partners. If you have a medical exemption, such as an allergy, your healthcare provider must provide documentation that addresses this so we can keep that on file. Based on this status as a student, your clinical assignment may be limited to certain facilities that accept exemptions. Many hospitals do not recognize this limitation for students.
Review the Nursing Student Handbook for guidelines related to physical requirements or licensure and eligibility. For example, if you sustain an injury that precludes you from meeting the physical requirements at clinical, such as washing your hands or performing CPR, you cannot attend clinical. We must have documentation from your provider regarding limitations and a clearance note once you're able to return to clinical without restrictions. This may also result in the need to withdraw from the course if you're unable to perform the learning objectives. You'll also need to pay strict attention to the cell phone use while in clinical. Check with your clinical instructors each semester about appropriate use of this communication and information source. Even though the cell phone is used to contact your instructor, use it outside the general public view for this purpose. Healthcare students have been expelled or fired from their jobs if they breach this confidentiality. It is highly recommended not to publicly post any information or pictures about your day as a student nurse.
Let us know if you have any questions or concerns about clinical compliance or clinical placement. We do use your feedback about the clinical experiences going forward. We are here to help you succeed. Good luck, and we look forward to seeing you soon.
Greetings. I am Dr. Mary Beth Reid, the lead instructor for N4581, Nursing of Adults with Complex Needs. Now, I know you have already heard about how challenging the Senior 1 semester will be. This course will focus on essentials of nursing practice related to adults with complex health care needs. These patients who have acute or critical illnesses that could result in negative health outcomes unless nursing care is provided in a safe, timely, and effective manner. The American Association of Critical Care Nurses, AACN, defines critically ill patients as those who are at high risk for actual or potential life-threatening health care problems. Patients meeting this definition are cared for in a variety of settings, including critical care units, emergency departments, telemetry units, step-down or progressive care units, and throughout the acute care hospitals. The nursing care for a critically ill or injured patient is often required to apply, analyze, and synthesize data from multiple sources during the provision of care to this patient population. Hence, this course builds upon your previous knowledge from pharmacology, pathophysiology, and your core courses, Foundations, Assessment, Nursing of Adults, and Psych. You will be challenged to apply evidence-based data and theoretical knowledge in order to deliver competent, holistic care for the adults with complex needs and provide progressively independent nursing care and electronic documentation on these patients. We will focus on the use of analytical, logical reasoning in the implementation of the nursing process and encourage you to collaborate effectively with patients, families, and the interdisciplinary healthcare team to provide safe, competent care. Our study will also include discussions of the ethical issues related to critical illness, including the provision of quality end-of-life care. Since critical illness or injury is resource and technology intensive, we will discuss the provision of cost-effective care for this patient population. I hope you enjoy learning about acute and critically ill patients as much as I have. And as you move through your course activities, try to relate what you are learning to your personal life and previous nursing experiences. Such reflection will make the work that you are doing much more meaningful as you learn to think like a nurse.
Hi, welcome to Senior 1. I'm Ms. Hoolapa and I'm going to be your lead instructor for OB. This is going to be a very busy semester. A lot of times students think that just because they have 2 courses that it's going to be a lot easier since you're used to having more classes. From talking with students in the past, this appears to be one of the busiest and sometimes the hardest semesters that you're going to have. You will need to be experts on time management. I'm sure you've heard that you have to have a calendar and write everything down so you can keep up, and I strongly encourage this. Please know when classes start and end. Not being present due to a vacation, to work schedules, or for a job interview is not an excused absence. Exams will not be rescheduled and they won't be made up because of work or vacation plans. Please also note that a lot of our clinical sites require clinical orientation or computer modules to be completed before the course actually starts. These dates are outside of UTA control. You must complete the computer modules or attend hospital orientation, even if it's due before classes start, or you can be dropped from the clinical and have to wait until the following semester to have an open clinical site placement. You must watch your UTA email, even while on break, so you don't risk losing your clinical spot. Answer your clinical instructor's emails promptly. On behalf of the OB clinical instructors and myself, welcome to Senior 1. We look forward to meeting you next semester and being part of your UTA journey.
Hi, my name is Meagan Rogers and I'm one of the faculty that teaches pediatric nursing in the undergraduate program here at UTA. The course of the next 8 weeks, we're going to spend a lot of time talking about pathophysiologic differences in children that make caring for them unique. There's plenty of research regarding the level of anxiety that undergraduate nursing students feel about practicing in the pediatric clinical environment. Because of that, we've structured the course with simulation to help get you warmed up and increase your comfort in the pediatric clinical setting. We have started the course with simulation that's meant to get you accustomed to caring for children. Because the course hits the ground running, very important that you keep a close eye on Blackboard for preparation assignments that will be very soon after the course starts. In addition to the course, students in this course have the privilege of attending pediatric clinical at 2 world-renowned pediatric healthcare sites. Because the patients you'll be interacting with at both of these facilities are very medically complex and fragile from a healthcare perspective, it is absolutely essential that you complete your clinical clearance requirements for the course. And students need to understand that you will not start this clinical or this course if you have not met clinical clearance requirements. So whether you've always dreamed about being a pediatric nurse, or this is only one course standing between you and graduation, we look forward to working with you soon.